Nutrition deficiency disorder have already covered in previous video. Now we will see its treatment. The topics covered under NDD are Dhatu Kshaya, Virudhahara, Balaroga, Kshaya, Dhatvagni Mandya, Pandu and Rajayakshma. Now general treatment protocol. We need to know both general treatment protocol and specific treatment categories for particular conditions. First reference I have taken from Charaka Sutra 23rd chapter. Most of the references for general treatment protocol is from Sandarpaniya Adhyaya of Charaka, where in this sloka it is mentioned instant nourishing therapies for long period should be given. In sloka you can see Syat Abhyase va Tadhishyate. Second reference is from Sutra 21st chapter, where it is mentioned light at the same time nourishing therapy should be given for the patient. Lagu Sandarpanam Chat is advised. Another logical approach is from Charaka Sutra 23rd chapter, which says acute and drastic weight loss, we need to go for regimen that nourish instantly. Sadhyakshine Sadhya Tarpana should be given. Next, chronic emaciation should go for long-term nourishment. The word Shira is mentioned for long-term nourishment here. So all these treatment references indicates that one should go for Brahmana therapy, that means nourishing therapies. Let's see who are indicated for Brahmana therapy. The reference says Shinaha, wasting, Shataha, wounded, Krisha, emaciated, Vriddha, aged, Durbala, weak, Nityamadvaga, who consume alcohol daily, who indulge in excess sexual intercourse, and in Grishma Ritu are indicated for general nourishing therapy. And another reference, in this Charaka have given some examples of nourishing articles such as Varaha Niryuha, pork meat. Let's see general drug and therapy, diet and lifestyle for this. Drug and therapy include Rajayapana Basti. Rajayapana Basti, they are medicated enemas where nourishing ingredients like ashwagandha, shatavari, meat soup, milk and decoctions of rejuvenating herbs are used. Then Shashtigashali Pindasweda, it is made with red rice. Grida Sevana, ghee intake like Vidaryadi Grida, because it is indicated for Brahmana Vata Pittaha. Then coming to Rasayanas, where Amalaki Rasayana Ashwagandha can be used. Another aspect is diet. Some examples for diet is Dugdha, milk, Grida, ghee, Mamsarasa soup, Shashtigashali rice, Goduma wheat, Masha black gram, Sharkara jaggery, Kharjura dates. Lifestyle include proper sleep and rest, then moderate exercise, daily abhyanga, oil massage, mental and emotional practices like meditation. Now we will start with specific treatment. First topic is Virudhahara treatment protocol, the disease which occurred due to incompatible lifestyle and diet. This is the reference from Charaka Sutra 26th chapter, where Acharya Charaka said the treatment as first the doctor should assess the strength of the patient, dosha and desha, the person where he resides. Then we need to go for Samyak Snehana and Swedana, that means Purva Karma for purificatory Panchakarma therapies. Snehana is oilation, Swedana is sudation. Later, once achieve Samyak Lakshanas, one should go for purificatory Panchakarma. In Sloka, it is mentioned Vamana, but here, according to the condition, we can go for Vamana Adi, Vamana Virejana Basti, or whatever is suitable for the condition. Next is Rasayana Sevana. After purification, then we will go for Samsarjana, then later on Rasayana Sevana. In Sloka, the word Shamana indicates Rasayana here, because in Chakrapani commentary, it is said that Kimva Tada Videridhi Rasayana Prayogaihi. One should follow Rasayana Prayoga after purification. We will see what are the rasayana options available here. First one is Chavanaprasha, Kshinakshadhanam, Riddhanam, Balanam cha Angavardhana. This is the indication from Chigisa Sthana first chapter where Kshinaha is mentioned, Kshinakshadhas. Another option is Amalaki Rasayana, then Ajamamsa Rasayana and Vidangadi Leha. Dhatu Agni Mandya Chikitsa, nutrition deficiency disorder occurred because of decreased Dhatvagni, thereby Dhatu Agni. That means decreased digestive fire and metabolic fire. Here, Dashavidha Langana is advised. Langana means reducing therapy. Even though it is reducing therapy, because of this Langana treatment, the digestive fire can be increased, thereby metabolic fire, so the absorption disorders can be rectified. This is the reference from Charaka Sutra 22nd chapter, where 10 types of Langanas are mentioned. Chadushpragara Samshuddhi means 4 types of purificatory methods and other 6 Langana procedures. These 4 types of purification include Vamana, emesis, Virechana, purgation, then Niruha Basti, a type of enema, and nasal drug administration. Another, the drug of option for digestion improvement are Pachana are Agnitundi Vadi, Chitragadi Vadi, Hingvashtaka Churna, Vaishwanara Churna. Then because of this, the digestion once regained, then we can go for Panchakarma treatments, that means purificatory methods like Vamanadi. Then by proper Panchakarma, later on the patient is given with the Samsarjana Krama, that is diet and lifestyle. Then go for Rasayana or Shamana as I mentioned earlier. Now nutrition deficiency disorder occur due to Kshaya Rajayakshma and its Chikisa include, this is the reference from Charaka Chikisa 8th chapter. So there will be Dhatvagni Mandya. Due to Dhatvagni Mandya, the essence of ojas is nourishment part, is not properly formed. And there will be Tridosha involvement in Rajayakshma. That means all the doshas, Vata, Pitta and Kapha are involved here. So we need to assess the patient, then go for purification and symptomatic treatment. Once patient achieved proper treatment, then additionally we can go for applications like Nyavarat paper. It's a medicated paste made of nourishing ingredients, especially a specific type of rice, Shashtikashali. Then Anna Lepa or Shashtikashali Lepa, all are synonyms. Then Chandanadi Lepa can also administer. Another option is Grida Sevana, ghee intake. They are Vasa Grita, Shatavari Grita, Dhuralabadi Grita, Jivantyati Grita. Another option is diet, which is nourishing soup, for example, mutton soup. Treatment principle of Dhatu Kshaya, nutrition deficiency disorder occur because of depletion in tissues of the body. The treatment approach is individualized approach, restoring balance, lifestyle and diet. Reference is taken from Ashtanga Sutra 13th chapter, where it says Vriddhastu Prashamedavya. Increased doshadadu should be pacified. Then Kshinastu Poshetavya. Diminished dhatus should be nourished. Sama Samatvena Daryate. Equilibrium state should be maintained. Now we will see each tissues and its treatment. First, Rasa Dhatu. Reference is taken from Charaka Sutra 28th chapter. Rasajanam Vikaranam Sarvam Langhanam Aushadham. Langhana is the line of management of all Rasaja disorder, lighting therapy. Once the metabolic fire is regained, then we can go for Brahmana, which include fresh fruits, milk, ghee, soup. Then go for Rasayana. Drug of options are Ashwagandha, Shatavari, Chavanaprasha. Later on, lifestyle management. This is the reference of Chavanaprasha Avaleha indications where Kshinakshadhanam, Vriddhanam, Balanam all are mentioned. Rakta Iron-rich diet should be advised like pomegranate, beetroot, dates, jaggery. Then drug of options are Mandura Basma, Loha Sava, Punarnava, Draksha. Reference Vidishonidige Adhyaye Rektajanam Bishakjitam. Here Acharya Charaka have mentioned a cross reference for Rektaja disorder. It has been mentioned that the treatment adopted in Vidishonidiya Adhyaya, Charaka Sutra 24th chapter can be taken for Rektaja disorders. Now Mamsaja disorders treated with Samshuddhi, Mamsajanam to Samshuddhi, purification. Then utilizing Shastra, surgery, Shara, alkali and Agni Karma, cauterization. Once this is achieved, we can go for Brahmana therapies with Mamsarasa, Masha. Drug of options are Ashwagandha, Bala, Kapikachu. Panchakarma like Abhyanga with Bala, Ashwagandha Taila, Mahamasha Taila and Mahanarayana Taila can be administered. Now Meda Chigilsa. Ashtav Ninditiye Adhyaya Medajanam Chigitsidam. The reference given in Ashtav Ninditiya Adhyaya of Charaka Samhita Sutrasthana 21st chapter can be taken for the treatment. Snehana, oilation which include ghee, oil, nuts, avocado can be given. Drug of options are Eshtimadu, Vidari Gandha. Panchakarma can be given with the Snehapana, oil intake, Abhyanga massage, moderate exercise. Now Asti Dhatu reference is the same reference. Astya Shreina Vyadina Panchakarmani Beshajam Basteha Shirasarpishiha Tiktako Pahitanicha. Astigada disorder should be treated with the Panchakarma, especially Basti, enema, prepared with the bitter drugs and medicines, milk and ghee should be given. Here we can go for calcium-rich diet, which includes sesame seeds, milk, leafy greens. Then drug of options are Laksha, Arjuna, Shankhabhasma, Pravalapishti. Panchakarma options include Basti, enema, which are Shirabala Taila or Balashwagandha Lakshadi Taila. Majjadadu Chikitsa. The reference says the Majja and Shukra disorder should be treated with diet having sweet and bitter taste. Coitus, exercise and timely purification are the treatmental aspects for both Majja Dhatu and Shukra Dhatu. Mutton soup ghee can be administered. Medya Rasayana, which include Brahmi, Shata, Shankhapushpi, Vacha, Guduchi, can be given for the patient. Panchakarma includes Shirodhara. Shirodhara is medicated oil is poured over the forehead. Then Basti, enema, Nasya, nasal drug intake by Brahmi Grida can be taken. Shukra Dhatu, Vrishya diet which include milk, ghee, almond, dates, saffron can be given. Drug of options are Kapikachu, Gokshura, Ashwagandha, Shatavari. Panchakarma, Basti, Vajikarna Rasayanas can be given. Pandu Chigilsa, nutrition deficiency disorder occurred because of anemia or Pandu. Reference is taken from Charaka Chigilsa, 16th chapter. Tatra Pandu Amai Snigdha Tishna Urdu Anulomikaihi is the reference, which says initially one should go for Purva Karma, Snehana and Svedana, oilation and sudation. Oilation options for drugs are Panjagavya Grita, Mahatiktaga Grita, Kalyanaga Grita. Then should go for Tikshna Shodhana, strong purificatory methods. Later Samsarjana Krama, diet and lifestyle. In Samsarjana Krama, we can adopt Purana Shali, rice, yava, barley, yusha made of mudga, adakki and masura, all are grains. Then Jangala Mamsarasa, that is soup made of animal meat. These are the treatment given for nutrition deficiency disorder in Ayurveda. If you know any additional references or additional correlations, let me know in the comment section. And thank you for watching.